So good afternoon again. My name is Freysia Kendrick. On behalf of United Benefit Advisors and Fisher Phillips, I would like to welcome you to today's presentation in the UBA Employer Webinar Series. Today's topic is considerations for employers handling COVID vaccine mandates. Our speaker today is Micah Dickey. Micah is a litigator in Fisher Phillips' Atlanta office. As a member of the firm's Workplace Safety and Catastrophe Management Practice Group, Micah represents clients during safety and health inspections by OSHA and defends them during contested OSHA matters. As part of the firm's COVID-19 Task Force and Vaccine Subcommittee, Micah advises employers on the many workplace law aspects of COVID-19. So Micah, I'm going to turn the floor over to you. Thank you.
Thanks, Freysia. Hope everybody's doing all right this afternoon. Thanks for joining the webinar. We've got a good bit to get covered, so we'll go ahead and get started. As you know, today's topic for the webinar is considerations for employers handling COVID vaccine mandates. And the agenda for today that we're going to talk about is who's subject to the mandate, how employees will be counted. We'll talk about recommendations on creating policies and procedures throughout, concerns surrounding testing requirements throughout. We'll do a deep dive on reasonable accommodations and exemptions. We'll talk about ACA and HIPAA considerations. So we'll transition to the next slide. As you all know, the impending OSHA mandate for vaccines or testing for employees is part of President Biden's path out of the pandemic. President Biden had a six-pronged strategy to combat COVID-19 when he came into office, and it includes vaccine mandates for federal contractors and many healthcare workers, and it also requires the aforementioned vaccine mandate that has yet to come out from OSHA. We anticipate that this will require all employers with 100 or more employees to ensure their employees are vaccinated or to perform weekly COVID-19 screening testing to ensure that no workers have COVID-19 in the workplace. And we also have a sense that, and again, the emergency temporary standard that we'll issue has not been sent out yet, so we don't have the text, but we believe that OSHA will require employers to provide paid time off for employees to get vaccinated. We'll cover first the September 9th, 2021 executive orders. There were two orders that came out. We'll cover the one talking about federal contractors. So there was a, separate from this mandate, this 100+ employee mandate, there is a current executive order from the White House where federal contractors have to have their employees vaccinated. And there's a pretty long list of what contracts are covered, what federal contractors will be covered, which ones are not. I would highlight that it appears that manufacturing contracts are not covered. So those employers, those contracts are not covered, as they would be contracts solely for the provision of products. But if there's an argument right now, if there are contracts for services or warranties, then you may need to go back and look and see if your client is a federal contractor covered by this executive order. Because not all federal contracts will be covered. Also, it doesn't have to be a formal contract. It could be something as simple as a purchase order. It does not include grants. The requirements for these federal contractors that are covered under the executive order, the first date that contracts will be covered by the executive order are October 15th, 2021. And there's kind of a complicated easing in period as to when these contracts will be covered. Just check the guidance. Safer Federal Workplace Task Force issued guidance on September 24th. The detailed discussion for the scope of the rule is outside the scope of this webinar, except to say for contracts awarded before October 15th, and if your performance is ongoing for your client, the requirements are incorporated whenever there's an option exercised or an extension made to that contract. The contract's made from October 15th to November 14th. The solicitation will include this vaccine requirement, and from November 14th onward, the vaccine requirement must be included in all new federal contracts, assuming that contract is covered by the vaccine mandate. Unlike what we think will happen, as I'll cover a little bit later, for the OSHA emergency temporary standard for most private employers, the federal contractor vaccine requirement does apply to remote employees with one minor exception. So the vaccine for federal contractors, full vaccination is required for employees by December 8th, with limited exception for those legally entitled to an accommodation, meaning medical or religious exemptions. Prior COVID-19 infection and antibody tests are not accepted as substitutes. We get a lot of questions about that. That's a big thing for employees. Well, look, I had COVID 2 months ago. That's not going to work. Vaccination is the standard. Mask and physical distancing requirements at covered contractor work sites are still required under this rule. And really, in addition to designating a person to coordinate COVID-19 in the workplace for these federal contractors, a lot of what this executive order says is follow current CDC guidance. So whatever the current CDC guidance is for your area of the country, based on transmission rates, and you can find that on the CDC's website, follow that guidance. So for example, vaccinated employees don't need to social distance. It's things like that. That's going to be an ever-evolving part of this executive order for federal contractors if you have clients that are federal contractors. Sorry, my slide deck froze. One second. A key requirement here, again, for federal contractors is that they must verify an employee's vaccination status by obtaining proof. You can't just do a self-attestation. So this is going to be for federal contractors covered by the rule. You're going to have to see the employee's vaccine card. It can be a picture or a PDF, like if someone has it on their phone, that's fine. But you are going to have to actually see proof. We've done a lot. Different states have had different requirements. Some employers have voluntarily mandated the vaccine, and it's kind of been an honor system. For federal contractors, the honor system will not work. You've got to at least see a picture of proof of a COVID-19 vaccine. That could be the card. It can be a record of immunization from a healthcare provider. It can be records from a public health or state immunization information system. Like in Georgia, we have something called GRITS. It's a state maintained database on vaccines. It could be a record from there or some other official document verifying vaccination. It just can't be their word. And again, this second bullet on other requirements, remember at covered work sites, follow CDC guidance. That'll be the key here. It could evolve. And so we really can't say, for all time what the requirements for mitigation at these work sites will be, but follow that guidance. Also, I wanted to note that the deadline, the last dose for these federal contractors, for the vaccination requirement, the last dose must be taken by these employees no later than November 24th, the day before Thanksgiving, because the deadline for these employees to be vaccinated is December 8th. So then you think, well, what about new employees at these federal contractors? After December 8th, any covered employee must be vaccinated by the full first day of the period of performance on any newly awarded covered contract. And, again, newly awarded contract or any exercised option or extension or renewed contract. So just for these federal contractors, December 8th is the deadline, but their employees, obviously, because you need a 2-week gap between the time of your last shot and when you're fully vaccinated, November 24th is really going to be that drop dead date. And now we'll get into the main part of the webinar, the forthcoming vaccine mandate. And this is what we anticipate. Biden's plan involves OSHA issuing a vaccine and testing rule that will apply to all private employers with more than 100 employees. It should impact 2/3 of the country's workforce. OSHA has said that the emergency temporary standard will be released in a matter of weeks, but of course that was in September. It has now been a matter of weeks, and so much like the last emergency temporary standard regarding healthcare, we are now still waiting for that standard. It could come out any day, and we will obviously update you when that happens. Fisher Phillips puts out lots of content on that. OSHA officials have urged businesses to voluntarily begin the process of adopting vaccine mandates without waiting for the agency to release the ETS. It looks like they anticipated somewhat of a delay. Once it's issued, this emergency temporary standard, or ETS, will have an immediate effect in the states where federal OSHA has jurisdiction, and it will remain in place for 6 months. Remember, any emergency temporary standard for OSHA will be in place for 6 months. OSHA has that time to then propose and go through the proper rulemaking and regulatory framework for a permanent standard, a new regulation. So at this point, we're waiting on an emergency temporary standard. It will be in effect for 6 months. And this is As far as we know, again, we do not have text of the ETS, but all employers that are covered by the OSHA Act must comply with the ETS. That is going to cover all states, and it's going to cover anyone with one employee or more. Well, I just said in states where federal OSHA has jurisdiction that this applies. Well, the OSHA Act covers all states. If you're in a state not covered by federal OSHA, you're going to then have to look to your state OSHA plan to determine whether they're just going to adopt OSHA's ETS wholesale. Will they make amendments? Will they draft their own? So you'll have to wait and see. But for states covered by federal OSHA, it will be in effect immediately. And what's key about this new ETS is that it includes many office-based employers that they don't have any experience with OSHA, right? Financial institutions, law firms, insurance companies, any other professional and technical work environment. A lot of offices have never had an OSHA inspection. And we've seen an increase since the pandemic of OSHA inspections, most of them remote, related to COVID-19. This vaccine mandate will bring about even more additional inspections related to COVID, but now that OSHA is back to conducting in-person inspections, we'll see an increase not only in COVID-related citations, but in other non-COVID-related citations. So I'll take a brief detour just to say that OSHA inspections, when an OSHA officer comes out, it's much like any other law enforcement officer. Anything they can see in plain view is fair game for a citation. And so during COVID, OSHA was kind of hunkered down in their offices conducting phone interviews for the most part. And so the only threat was what was reported from an employee, what was the complaint related to COVID-19. But in the future, there's going to be a lot more in-person inspections. And so you want to be prepared for that. And you want to at least be sure that you're compliant with this rule, because OSHA is focusing more and more on these, non-manufacturing, non-construction, non-general industry workplaces, and will conduct those inspections. As I said, in states where federal government does not have jurisdiction, the state agencies will have to adopt the emergency temporary standard, and they have 15 to 30 days to do it. So it's going to be a very quick turnaround. So don't think that you're off the hook if you live in Georgia, Florida, Alabama, Mississippi, those states covered by federal OSHA. It'll be fairly quick. It'll be in the news. You'll see it. We anticipate that probably half of the state plans will simply adopt the ETS. The other half will kind of redraft the ETS to suit their needs. Governors, as you know, governors of some state plan states have already come out against the ETS, which could set up a battle between the state plan agencies and federal OSHA. There are currently 22 state plans covering both private sector and state and local government workers. And then there's another 6 state plans that cover only state and local government workers. So in 22 states, there will be an issue if, say, Texas's governor just issued an executive order saying there won't be any mandatory vaccinations in this state. Well, Texas is a federal OSHA state, so that doesn't really apply here. But say California did, which they wouldn't, but another state plan did. If another state plan did that, you would then have to think, okay, like Virginia, how does that interact with the federal OSHA standard? We do not know yet. We haven't seen the legal challenge, but given that OSHA has already said it will be a mandatory vaccination requirement or a testing requirement, probably any executive order that says no mandatory vaccine, that might be enforceable. You may just in those states have to provide routine testing. It's just going to be a burden on employers in those state plans. But again, we don't know yet. We don't know how many governors will do that, but that is out there. Now to some unanswered questions that we get a lot, and they're key questions. How will the 100 employee threshold be counted? It's not clear. OSHA officials, the Friday after Biden made his announcement, suggested that the threshold will be the total number of employees at the company rather than at each work site. OSHA generally treats each work site as an establishment. And so for record keeping purposes and different things, it says, okay, well, what are the employees at this establishment? When you conduct an inspection and when you respond to OSHA's inspection and questions about a work site, it's for that work site. Here, for coverage of the emergency temporary standard, we believe it will be 100 employees company-wide. We don't know yet about what the analysis will be for, say, if you have a company where you've got 6 pretty tightly affiliated LLCs, say you've got a restaurant chain, your client has a restaurant chain of 50 LLCs operating 50 restaurants. We're probably going to advise that most likely you should count them together. And they're going to be over the 100 employee threshold. It depends on the volume. Some restaurants wouldn't have 100 employees, some would. It's also unclear how the joint employer analysis will factor in, because we've seen in a lot of OSHA standards, if you have temporary workers For OSHA purposes, OSHA generally considers temporary workers to be your employees. We don't know yet if you had, say, one work site, the company just has one work site, you've got 50 full-time employees that are your W-2 employees, and you've got 50 temp employees. Will you have 100? We just don't know yet. And will remote employees be covered? According to comments from OSHA, it will not apply to employees who never come to work. So unlike the executive order for federal contractors, here we anticipate the rule to say, as long as an employee never comes to a physical work site and works from home, they will not be covered. And generally, just like in the healthcare standard, the emergency temporary standard for healthcare that came out a few months ago, there will be a definition of at-home workers or teleworkers. That's where we'll see this definition, and we'll know for sure when the language comes out whether or not remote employees are covered, but we think they will not. But remember, if you've got someone who just comes in once a month, that employee is going to be covered by the vaccination testing requirement. The next thing that we get a lot of questions about is, will employers be required to collect proof of vaccination? We don't know. Whereas the federal contractors are going to have to at least see the proof. They can't take an employee's word. We don't know yet if OSHA will require you to actually store that proof, because if OSHA comes and says, well, how do you know that the employee was vaccinated, and you show them a list of employees, just a spreadsheet, which is what we recommend doing generally, will OSHA consider that enough? Probably not. So they're probably going to say you need to actually have a record, actually collect proof of vaccination, or maybe it'll be something like in the middle, a certification. I certify that I saw these employees and saw their vaccine card, or another official record. But consider, if you do collect proof of vaccination, OSHA requires record retention for a length of employment plus 30 years. So at this point, until the rule comes out, when you're advising your clients as to whether they should roll out a mandatory vaccine, we're saying, look at the vaccination card, but then just keep one confidential spreadsheet and keep that under lock and key, so that you're not having to keep all these different copies of the vaccination record cards, excuse me. And so then what type of testing will be required? We really don't know. The PCR test is more accurate. It takes longer to receive and the results, and it's more expensive. So we do not anticipate OSHA allowing the rapid tests. The CDC and different entities have come out and said that those tests are unreliable. So we believe it will be a PCR test, a diagnostic test, probably antigen, but it could be molecular antigen, which are the two diagnostic tests that are available. There are, the FDA website lists approved tests, some for home collection, where they're still tested by a laboratory but collected by the employee at home. We just don't know yet what will be allowed under the OSHA standard. We anticipate that it will give some guidance, and then it will be silent. And because probably given supply issues throughout the country, they may allow these home collection kits where they're collected by the employee but still tested by the laboratory. We think that will be the case. It probably won't be where the employee collects the specimen and performs whatever testing is necessary and gets a result, because that is too close to a self-attestation. So we think it's going to be somewhere in between the full-fledged lab PCR test and the home test kit. But again, the FDA website lists approved tests. You can go on there. I just did it today. There are dozens of approved tests. And so you will want to think about, in terms of policies and procedures, if you're going to go the testing route, how are you going to actually acquire this sufficient number of tests? And you got to think, you at least need to plan on 6 months. You need 6 months of testing. And so multiply that out by your employees, take out obviously the people that are vaccinated, because we anticipate that if you're vaccinated, you don't need to be tested. Obviously, it's either or. So maybe you've got 30% of your employees, your clients has 30% of their employees that aren't vaccinated. And so that number of employees for the number of weeks for 6 months, that's your worst case scenario, most likely. We do not anticipate OSHA saying that it will be twice a week testing, but it could be. We don't think so. We have seen some clients institute twice a week testing in lieu of mandatory vaccination. On to the next issue of who pays for the testing. Again, we haven't seen the language of the emergency temporary standard. At this time, insurance is covering the cost of the test, and there are several states that have state laws predating COVID-19 requiring employers to pay for mandatory medical testing or reimburse employees for such testing. And at the moment, the Families First Coronavirus Response Act, as you all know, ensures that COVID-19 testing was free to anyone in the U.S. And so that really shouldn't be an issue at this point. You will have some clients who have a substantial number of employees who are not on their health plan. That could be an issue, and that's something that has to be dealt with on a case-by-case basis. And the reason I'm talking about testing is because the vaccine, in some sense, is pretty simple. If you require the vaccine, it cuts down on the limited number of issues. But if you require testing instead of vaccination, these are the things you have to consider. So again, not only who pays for the test, what about the time spent for the test? Generally, while there's not a clear answer, the Department of Labor stance generally is going to be time spent by employees receiving employer-required tests should be treated as compensable. So if testing is required during the workday, or if it's deemed necessary to perform the job safely and effectively. Well, think about it. If it's required under an OSHA standard and you're requiring testing in lieu of vaccination, it's going to meet that standard. You need to pay employees, your clients need to pay employees for the time spent acquiring the test. Another question that pops up a lot that we don't know if the ETS will answer is, will unionized employers be required to bargain over the decision on how to comply with the ETS? Because remember, this is a choice. It's vaccination or testing. Do you have to bargain if you're unionized over that decision? We don't know. At a minimum, be prepared to do so. Be prepared to do so, especially over the effects of compliance with the ETS, especially if you go the testing route. How is that going to be administered? Who's going to administer it? What's going to be the penalty for non-compliance? And non-union employers should consider the practical implications of compliance from a labor relations perspective. I mean, simply put, if one of your clients chooses the testing option and all their other competitors in a high transmission area chooses the vaccination route, they may either be awash in employees, or they could have a lot of employees there saying, hey, like, I don't feel safe here. And it could be open for organizing activities that your client doesn't want. So that's something you have to think about. A huge question, will the emergency temporary standard face legal challenges? Most likely, I could have put definitely, and it would be the same. I mean, we anticipate challenges. Governors have already said that they intend to challenge the standard on behalf of businesses in their states. Courts could block enforcement of the emergency rule or parts of the rule until the challenges are resolved. Again, given that it's an option between testing and vaccination, I think if it were vaccination, I think it's pretty clear that a court would probably block enforcement of the rule, and we wouldn't have to really worry about it for quite some time. But given that there's a testing alternative, it's possible that your clients need to be prepared to comply with at least the testing portion of it. If they didn't want to do mandatory vaccination, they need to really look at the testing, because it's unlikely that a court will block enforcement of the rule for testing. And OSHA has to prove that there's a grave danger to workers. And so, a little bit into the weeds here, OSHA has to provide that justification. And a lot of your clients may think, well, who can challenge this law? Any person who's been adversely affected by a standard, I'm reading this straight from the United States Code, by a standard issued may at any time prior to the 60th day after the standard is promulgated, they can file a petition challenging the law in the United States Court of Appeals for the circuit where that person resides. So if you've got a business in Georgia, in Alabama, Florida, Illinois, and they want to challenge this law, they have up to the 60th, prior to the 60th day after the rule comes out. So again, we're all going to be on it, watching it. And so some of your clients will want to file that petition in the United States Court of Appeals. Note that filing the petition does not stay the rule. It says here courts may block the enforcement of the emergency rule, but just filing the petition won't stop it across the nation. The court will have to rule on that. And there's been a lot of emergency temporary standards that OSHA's attempted over the years. Note that OSHA's emergency temporary standard for healthcare was promulgated a few months ago in June, and it was the first emergency temporary standard that they successfully issued in more than 4 decades. OSHA, when that ETS came out, put in a preamble of more than 200 pages. Much of it was devoted to how OSHA determined that there was a grave danger to workers. So that's going to be the key here, is how does OSHA justify that vaccine or testing, the absence of vaccination and testing is going to present a grave danger to workers. And we'll really have to see. For the healthcare ETS, OSHA critiqued the tools that it had at its disposal, the general duty clause. It also talked about deference to the CDC. So we really have to see whether or not the record would support OSHA's conclusion that this new ETS will be necessary. We get a lot of questions on whether or not it can be challenged. It can. So what do you do in the meantime? Because we do recommend go ahead and prepare for the standard to be issued and to be enforceable, and for OSHA to immediately conduct inspections. And so you want to adopt procedures for determining employees' vaccination status first. Well, why is that? Well, you do need to know who's vaccinated. Your clients need to know which employees are vaccinated so that they can then make an intelligent call on, okay, well, we've only got 10% left of our workforce. We either mandate the vaccine for the rest of them, or testing wouldn't be that onerous and we don't want to mandate, so we'll do testing. And so you've got to know who's vaccinated. And so you want to maintain those confidential records of the status. Again, unless the standard says that you have to keep a copy of the proof of vaccination, we recommend the highest management official at any particular work site view the proof of the employee's vaccine and then mark it on a confidential spreadsheet. Again, this is kind of standard at this point. We all know the EEOC has indicated that employers can ask about an employee's COVID-19 vaccination status. That just needs to be the end of your inquiry. Don't ask further questions. Again, the standard could require you to collect proof, your clients to collect proof of the vaccine. So we'll just have to wait and see what that says. And again, review state laws regarding confidentiality and privacy of medical records. It could be that your state law provides something above and beyond what federal OSHA or even your state plan could require. So once you've determined who's vaccinated and who's not, once the standard comes out, or even now, you have to determine, will you mandate the vaccine or allow unvaccinated employees to be tested weekly? For some employers, collecting and tracking weekly test results, assuming it's only weekly, may burden them, so they decide everyone's going to get the vaccine. It depends. It depends on where you are in the process at the moment. If your client, again, has a very high vaccine rate, it could be that this is not a burden to do testing. Or it could be, let's just get it as close to 100% as we can. OSHA officials have stated that employers may require vaccinations without providing the alternative for weekly testing, subject to accommodations, which we will discuss in depth in a moment. But OSHA has made it pretty clear this is an or, and that's why I mentioned it in the labor section. If you're in a non-union workplace and you don't have any organizing concerns, it's literally going to be up to your client whether or not they want to do the mandatory vaccine or the testing. We don't have the language of the rule, but the OSHA officials have stated that's how it's going to be. That could change, but they've told us it's either or, and it's the employer's choice. If you're planning on weekly testing, think about the logistics. Again, are you going to do an on-site vaccine clinic? Are you going to do designated vendors? Or are you just going to say you have to provide proof of vaccination, employee, by this date of your first dose and then your second dose? Think about payment for testing. Again, that if they're under your health plan, that should already be covered and taken care of and not really a logistical issue. Payment of time for testing, that's a little bit more of an issue. You're going to have to track that. And again, we're covering tracking test results because, again, if you've got a spreadsheet of who's vaccinated and who's not, it's just a matter of ticking off names until you get to 100%. But test results, it's going to be a weekly burden. So you need to have a plan in place for collecting and tracking the results. Who's going to collect the results at each work site? When will the test results need to be collected? So when does an employer need to present that test? We have seen to get into the building on Monday morning, you have to present a negative PCR test that was taken within 72 hours of the date the employee is trying to get into work. So like on a Monday, the test need to have been administered 72 hours before that. That could be the rule. It could be a little less. It could be a little more. We don't know what the standard will require, but absent that, you have to decide when will the test results be collected and what's the standard? And then also, what's the window for collection? Do they have 24 hours? Best practice would be the employee doesn't enter the premises until they present that test result. We've had some clients say, well, we'll let them come in Monday and they've got the whole day Monday to give us the proof of the negative test. I think that's a bad idea because then they could be walking around with COVID all day and you're not really going to have a defense. Well, you made them get a test. You couldn't just wait. You couldn't just hold them at the door and make them present that test result. Then how will you track the results? Do you need to track the results? You will for purposes of shift coverage for your clients, they'll need to think about what happens when someone puts in or presents a positive test result. And this is the issue with routine testing. There are going to be employees that show positive that don't have symptoms. They're going to have to be excluded from the workplace. And so while it's not a blanket recommendation, vaccination at this point, if you're going to be covered by this OSHA ETS, is probably the easier answer, because again, they test positive for COVID and you're going to be testing them weekly. That's going to be a lot of absences. That's going to be a lot of coverage issues. And you got to think about, can you meet your business needs? Can your clients meet their business needs? And then have a plan for addressing non-compliance. What are you going to do if an employee does not get tested? How about if an employee refuses to get vaccinated? How about both? What happens when an employee says, you know, I'm not going to do either. I'm just not. And you've got to think about, if your policy is mandatory vaccination, are you going to provide alternatives without a medical or religious reason? If you are, does that comply with the OSHA ETS? We simply don't know yet. We don't know if there will be some carve out, or if you're going to have to pick one and you're not going to be able to carve out any exceptions except for medical or religious reasons. We're not sure yet. Probably plan on one or the other, and that's it. Right now, you have the choice to say, you know, to choose one and then make some carve outs. And so this is where we get the most of our questions, and that I think is most relevant for your clients, is that you need to develop, you know, policies and procedures, develop a plan for handling accommodation requests. And we'll start off with religious accommodation requests, because those are most unfamiliar to your clients. They're a lot rarer than medical accommodation. And we've been dealing with them now during COVID, but really the question is, how do you handle these religious accommodation requests? And there may be federal law. There may also be some state laws. So check your local state laws where your client operates to see, are there state laws also that come into play. And most of your clients, if they're sophisticated, should have a robust and clear reasonable accommodation policy already in place to address religious and disability issues. But if they don't, they need to put one in place immediately if they're going to be covered by the ETS, because they're going to be going to that well over and over and over. And you want the management official or the human resources official that's going to be dealing with the employees and dealing with these accommodation requests to have that guidance, to know step by step, what are they supposed to do? And when there's a policy in place, you need to designate someone at each work site. This person is going to be the one to deal with these accommodation requests, or it could be higher than the unit. If you've got a client who has multiple units, you can make it a manager that manages 5 units, 10 units, whatever the case may be. It's most appropriate for the number of employees your client has, so that you're applying it uniformly and fairly. And once you have the policy in place and you have the person in place, you need to have that person administer the accommodation process thoughtfully, emphasizing individualized, confidential considerations for each request. Again, confidential considerations and individualized assessment. A lot of this your clients will already know, but understand that be prepared also. Employees are going to request accommodations from the weekly testing requirement. For your clients that don't do mandatory vaccinations, we have seen some employees say, oh, I'm not going to get tested either because I have a disability or I have a religious reason that I can't get tested. So don't be caught off guard. Don't let your clients be caught off guard by this. We have seen those. And, you know, the bottom line is that the EEOC has made clear that employees can be excluded from the workplace for not being vaccinated pretty much only when there's a direct threat or there's some qualification for their job position. So think healthcare, you know, some standard, some requirement of their job duties that requires them to be vaccinated. Those are pretty high. That's a pretty high bar. Direct threat is when an unvaccinated worker poses significant risk of substantial harm, which cannot be eliminated by a workplace accommodation. So that's pretty high for vaccines. For testing, it might not be as high. It depends on what accommodations are left. So if you do the testing route and you don't mandate vaccines, and your client mandates testing, and someone brings a legitimate accommodation request, you engage in the interactive process and you determine, okay, we need an accommodation here. It depends what accommodations are left, because presumably you can't go the vaccine route because they have that objection. Maybe they don't, but probably not. And so then where do you go? Can they be isolated? Can they work remotely? It really just depends on each client's individual situation. And so a deep dive, and we'll start with religious accommodation. Step one, decide whether the objection, again, this is starting with the religious accommodations, decide whether it's based on a personal choice or a sincerely held religious belief. Again, an employee just can't raise and say, oh, that's against my religion and give no other details. That's just not going to work. That's not a legitimate request for a religious accommodation. But you should generally assume that an employee's stated belief is sincere unless you have a good faith and objective basis for questioning the religious nature or sincerity of the stated belief. You need to train your managers and human resources people, but the contact that's going to be working with employees, now's not the time to get cute, right? They really, don't try to, really delve into someone's history and, oh, I know this and I know that. For the most part, religious beliefs are generally going to be sincere unless you've got really some good faith basis to question it, right? I mean, if they say, oh, I'm a member of a church and it's, they admit like it's online and they've got some religious certification and it looks like nothing you've never seen before, then you might could ask some questions, but you don't want to spend a lot of time and company resources investigating the genuine religious belief issue. Your questions regarding an employee's stated belief should be answered through the interactive process. So you still probably need to go ahead and engage in the interactive process. It's not enough to say, oh, this sounds bogus, so I'm not going to answer this. No, have the person designated go through the interactive process and talk about, okay, well, this religious belief, what exactly does it entail? How does it affect your ability to have a vaccine? Remember, though, we have a lot of questions from clients. Well, wait a minute. 2 years ago, this employee got the flu vaccine at a clinic here on site. Now they're saying their religion doesn't allow them to get the COVID vaccine. Remember, religious beliefs can change over time. That in and of itself is not going to be enough to refuse an accommodation based on a religious belief. Step two, again, engage in the interactive process. If you conclude that the objection to the vaccine mandate or the testing mandate for that matter is grounded in actual belief, go through the process like you would for a disability accommodation request and figure out, is there an accommodation that we can use here? What's possible? You don't have to do any accommodation that's an undue burden. You don't have to do what the employer requests. It's what's reasonable. And step three is make a decision on the accommodation request. So you've got all the information you need, you've got to make a call. There's a few principles here, and you may end up concluding that there's no accommodation that's reasonable, or there's an accommodation, but it would cause an undue hardship. Remember, for religious accommodations, you don't have to prove as much as you do with medical accommodation requests, disability accommodation requests. For religion, if you can point to a religious accommodation request, if you can point to any measurable increased cost to the company, you might be able to deny a request for religious accommodation. But let me be clear, that standard will not work for disability accommodation request. It just doesn't work. You shouldn't rely on that. The standard, the words are similar, but it's a much higher burden when we're talking about medical conditions. For religious accommodation request, if it's really going to be a huge undue burden and it's, your client can point to it, then they should seek counsel, and it should be a pretty quick decision, all other things being equal, but that will not work for medical issues. And so let's say that your client has an accommodation that they think would work for the employee and they offer it to them. The employee can't refuse all options, holding out for something better. That's not what the law states. And if there is no other accommodation, you've identified one, you think it's the only reasonable one, you've got data to back it up, you've documented your reasoning, which you should always do when entering in the interactive process for these accommodation requests. If there's nothing else that's reasonable, everything else would be a huge burden on the company. Again, talking about religious accommodations, you may need to exclude them from the workplace. You might be in a position where you could place the employee on unpaid leave of absence until something changes. The transmission rates in your area go down. That might change the analysis, because remember, accommodation requests are hugely fact intensive. You can't just make a quick snap decision, and we always recommend involving counsel for these decisions. And again, I already talked about undue hardship for religious accommodation requests. And one more thing on religious accommodation requests, again, you may be able to make an accommodation for the first employee, for the second employee, for the third employee. At some point, the multiple accommodations and the cost and the logistics and the issue there can be a factor for religious accommodations for an employer. So if you've got 20% of your workforce that you're having to accommodate due to religious accommodation requests, at some point, number 21, number 20, the next employee above that threshold is going to be unreasonable or could be unreasonable and defensible. Medical accommodation requests, not really the case. Just like any other medical accommodation request, whether they're objecting to testing or the vaccine, although we haven't seen a lot of medical accommodation requests for testing, assuming it's out there, you can ask the employee to provide the appropriate documentation from their healthcare provider about their request and their impairments, the duration of the need for that accommodation, and how it conflicts with your vaccination requirement or your testing requirement. We have found that at this stage, most of the medical accommodation requests to testing have kind of fallen apart and the employee has dropped the issue. The vaccine, they've had a much stronger position and those require much more careful analysis. And so the next slide, that's accommodations that you're going to have your clients are going to have a lot of accommodation requests. So that's why I spent a lot of time on it. Because again, if you're covered by the emergency temporary standard, you've got more than 100 employees. We don't know yet because we haven't seen the text, but there's not going to be a carve out. It's going to be one or the other. And then employees do have the option, however, to present medical or religious accommodation requests. And so be prepared to deal with those. And if your client doesn't have those policies in place to deal with it, they need to put those in place now. And as I alluded to at the top, prepare for OSHA complaints and inspections. The vaccine ETS won't really affect the current OSHA standards that are in place for workplaces. When OSHA shows up, whether it's in person or virtual or via a letter, they will ask for your COVID-19 response plan and training records. Again, if you're not healthcare, COVID-19 response plan is not required under the OSHA Act, but it has been recommended by OSHA for, let's say, over a year, at least since January of this year. And so, you're going to be hard pressed to say, oh, well, we don't really have any documented COVID-19 mitigation efforts. We don't have a COVID-19 response plan. That's going to draw a general duty citation more than likely, especially if you're a big, sophisticated employer and you have a lot of employees. If you've got one or two employees that never come in contact with the public or each other, that's a different circumstance, right? But again, you wouldn't be covered by the ETS, and so your odds of getting an inspection related to COVID-19 is greatly diminished. So again, develop a COVID-19 policy, communicate its requirements to your employees. You would encourage your clients to do that now and train managers and supervisors on what to do and say if OSHA arrives for an inspection. It's beyond the scope of this webinar, but I want to emphasize managers control the scope. Your clients should make sure their managers control the scope of the inspection. If the OSHA inspector is there to determine if you're complying with COVID-19 mitigation efforts or the COVID-19 vaccine or testing ETS, they can only see parts of the worksite that are most relevant to that. They don't just get to see everything. Documents, they don't get all the documents. They get documents related to COVID-19. And again, control statements, managers are important. Control the statements that your clients' managers make to OSHA. Those buying the company, it's as if the company said it themselves. And you have the right, your clients have the right to have counsel present when OSHA interviews managers and supervisors. And that doesn't just have to be someone who hires and fires or has this great title. If they're responsible for health and safety, if they're implementing the OSHA ETS at your work site, if they're making sure people wear masks, call them a manager. If they're responsible, and OSHA's going to treat them accordingly. So some other things, options for increasing vaccination rates if you don't mandate the vaccine, because again, a lot of the webinar, the vaccine is the easy part in a way, except for the accommodation process, but you have to go through that with testing anyway. So if you don't want to mandate the vaccine, your clients can either do an information campaign or incentives. And I'll go through these fairly quickly. There's a lot of misinformation on the internet and on TV and different sources of media. Many people believe that they have to pay for the vaccine. They're free of charge. Many people just don't understand, now that there's a booster shot, people are saying, well, wait, are vaccines even effective? And so you want to address those questions, have, competent managers who've been trained in this type of thing to talk with the employees, talk them through those concerns, because every employee that your client converts to getting the vaccine or submitting to routine testing without going through the accommodations process through, like, say, either one-on-one meetings or some kind of town hall is one less request for an accommodation that the company could potentially mishandle, and that could result in a lawsuit. So it's worth the time. This information campaign is worth the time. Informal question and answer sessions, Q&As, share stuff from the CDC or other trusted sources. Again, always make sure that you're prepared and trained. This is not one of those show up 10 minutes beforehand to do a presentation, manager at a work site. They really need to be trained so that you can convert people and make sure that you're getting, compliance. As I said, provide materials that people can take home and discuss with their family. Use language that's appropriate for your employees. Make sure it's in a language they can understand. We don't know yet the content of the OSHA standard, obviously, but OSHA's big thing for training is the training has to be in a language the employees can understand. If you've got people where English is their second language, the materials you send out need to be in the language that they understand fluently so that there's just no misunderstanding. And again, pay employees for time spent on this. So pay them for the time spent in any information sessions. It will be worth it in the long run because you'll have less accommodation requests. And so can you incentivize? So that's the information campaign. Can you incentivize? Yes, you still have the same accommodation obligations. That is, employees can still present religious or medical accommodation requests for incentives. They can say, I can't, if you've got an incentive to get the vaccine, they can present an accommodation request and get an alternate way to earn those incentives or avoid a negative incentive. Be cautious. There's a lot of conflicting guidance. The EEOC had said de minimis was okay, and that was all. Then they said, well, if it's not your agent, if an employee voluntarily goes out there and gets proof of the vaccine at a drugstore, presents it to you, the incentive could be, there's really no limit. Remember, if you're covered by the OSHA ETS and you choose the mandatory vaccine route, that doesn't apply to you. So you really need to go the de minimis route. It's always okay. Water bottles, modest gift card, like $25 or less. Now, what's a little bit more unclear is what if you choose the testing route? You're not going to require the vaccine, and then your employee brings in proof of vaccination voluntarily. We haven't, really delved into that issue, but that could be a situation where the incentive could be higher than de minimis because you're not requiring the vaccine, you're requiring testing. And so the former rules, even if you're covered by this standard, could apply. And as you all know, your clients should know, cash, gift cards, paid time off, raffles, as long as it's voluntary, things like vacations and fitness equipment can be used as incentives. But again, if the vaccine is mandatory, if you make it mandatory, then a lot of the very expensive things are off. It's really going to be de minimis at that point, because remember, any incentives, if it becomes coercive enough to where it's not voluntary, that's going to affect the wellness rules. And as I said, consider an alternate means for employees to earn the incentive. And so I didn't mention, what are some potential options to earn the incentive? Watch a workplace COVID-19 safety video, reviewing CDC literature, COVID-19 testing. Again, this is, if you want to incentivize people to get the vaccine, these are things you can do, that your client can do. And again, all documents and information about an employee's vaccine status should be maintained confidentially. You cannot offer incentives to your employees in return for their family members getting vaccinated, but you can allow them to participate in a clinic voluntarily if you follow all other applicable privacy rules. And so then surcharge considerations. HIPAA and the ACA, you can develop a properly designed wellness program that takes vaccine status into account, but it does have to comply with HIPAA. And so you want to look at 6 key things. Does the surcharge, if you're going to do a surcharge, does it comply with wellness incentive limits, taking into account existing incentives? So if you have a smoking cessation or biometric screening program, you have to think, taken as a whole, do these incentives comply with HIPAA and the ACA? Specifically, does the surcharge allow you to maintain compliance with the ACA employer mandate affordability rules? When you take the incentives together, incentives are limited to 30%, up to 50% for tobacco surcharges of the total cost of employee-only coverage. If you add a new incentive, a new surcharge, it could cause your plan to exceed the limit, and that would require you reducing or modifying your other incentives. Also, a key thing here that we've noticed that people are forgetting, non-tobacco related wellness incentives must be treated as not met when you're determining ACA affordability. So if you add a vaccine related surcharge, effectively it increases the cost to employees and makes it more difficult to offer the coverage at an affordable amount for the employee contribution. That's something you have to keep in mind. And then, some other quick things. Can this be implemented mid-year? Can you do it? Can you roll it out? May employees opt out if they experience a cost increase? Does the reasonable alternative standard offered comply with the activity only or outcome-based rules? Then this is a big one. Again, check your state laws. Do state laws prevent or limit such a program? Especially, again, being mindful of these state executive orders, making sure that you're not violating those orders. Will booster shots be required to earn the incentive? And at what point will you conclude that booster shots are necessary in order for workers to be considered fully vaccinated? That's a point I wanted to raise at this point about the vaccine. We're not sure, but we believe that it's going to be fully vaccinated is not going to include a second J&J shot or a third Pfizer or Moderna shot. We believe that it's just going to be the status quo and that boosters are not going to be required. If you want to go above and beyond that, you need to make that clear in your policy so that everyone understands what they have to do to be fully vaccinated, to comply with your mandatory vaccine policy or your incentive policy. And this one, shockingly, some of your clients may have this question: can employers limit group health plan coverage to those that are vaccinated, or limit health plan claims for COVID-related illnesses to only those who are vaccinated? No, that action would clearly violate HIPAA. HIPAA has the non-discrimination rules and should therefore be avoided. It's really just not something that clients can do. We understand the rationale, but again, lean on those incentives, or if they're covered by the ETS, choose the mandatory vaccine route. And if you choose the testing route, then lean on the incentives. And so that is the end of my presentation for today. I'm going to hand it back